Hey guys, hi, welcome to Unacademy. This is Unacademy Future Doctors, and I am your educator for biochemistry, Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you, and then we can resume. Just give me a minute to check if the stream has started and if I'm visible and audible to all of you. Just a second, I'll check. Okay, am I visible and audible? Let me know. Let me visible and audible. Yeah, is my video clear to all of you? Am I audible? Okay, so I'm Dr. Shivangi Shukla, and I'm your educator for biochemistry here on Unacademy Future Doctors as well as the Unacademy app. Uh, I have completed the super fast crash course, the rapid revision series, and the Focus Prof 1 series. That is a comprehensive a comprehensive study of each and every subtopic of biochemistry that is going on right now, and I take integrated sessions also with different educators here on Unacademy Future Doctors. Now, what I have been doing is after we complete a certain chunk of the syllabus throughout the month, in the last week of the month, I keep that for revision. Okay, because simultaneous revision is as important as reading, as understanding. So this last week of January, I have kept for 2 questions per day series. Okay, I'll be taking 3 such sessions every day. So in total, I'll be discussing 6 questions every day, and those questions will be based on different concepts. So I'll give you 5 minutes to answer each question, and after you answer the question, we shall discuss the topic behind that. Okay, the theory behind that. All right, so let us begin. Okay, I'll just quickly brief you about the different types of subscriptions for Neetpp available on Unacademy. You can go and check out the Unacademy app, and please think of subscribing, consider subscribing, because in today's scenario, when COVID cases are rising and how, then online education is, I think, the most go-to form of education to maintain any sort of regularity in your studies. Okay, so both Plus as well as Iconic subscriptions will give you access to resources from an academy, video, as well as the live as well as recorded videos of top educators. The Iconic subscription in addition will give you resources from Prep Ladder as well. Okay, and do not forget to put in the educator code DRSHUKLA, Dr. Shukla. This code is going to fetch you an additional 10% discount. So guys, it is I would like to urge you to try this subscription out, because in today's times it is really important that um, try this out. Okay, today's times, online education has been revamped. It is revolutionized by an academy, and you can find a lecture or any kind of special class on each and every topic that you can come across. So we are here to solve your doubts. We are here to provide you easy learning, illustrative learning, but you should come and you should ensure your trust in us. Okay, so please do think of it, and it is highly subsidized. You can also apply the educator code DRSHUKLA, Dr. Shukla, for additional 10% discount. All right, so I'll be putting up a question, and you have to answer that in the chat section here only. Okay, so just look at the question, try and understand it, and then answer it in the chat section. A patient presents with macrocytic anemia, homocysteine urea, and normal methyl malonate levels. Okay, what is the most appropriate treatment? Now look at each word carefully and then go for the answer. vitamin B9 and B12, only vitamin B9, only vitamin B12, or iron. Okay, look at this and then answer. Okay, all right. Try and understand, look at each and every word carefully, and then go on to answer this. Okay. Come on, guys. Answer in the chat section. Come on, try and answer. There's no shame in answering the answering with the wrong answer. Okay, it is not a problem. You should be hesitant in not answering. Okay, not answering is a problem. Think of it. Think, at least have a direction of thinking. Okay, try and develop your thinking abilities, and then try and answer it. Okay. Come on. Come on, guys. Try and answer. The time is running up. Okay, last 2 minutes. All right, last 2 minutes. Come on. Put on your thinking caps. Exercise your gray cells. Come on, juggle your mind and try and answer. Excuse me. All right, last 30 seconds for you guys. Okay, so now I'll tell you the answer. Wow, okay. So Prerna has answered vitamin B12. Okay, Prerna is saying it is C, vitamin B12. Very good. Prerna, see, Prerna always tries and answers. I have seen her in 2, 3 classes. In the last class also, day before yesterday also, in on Unacademy also, she was very interactive. Very good. This is the way you should be. There are a few other students also who always try and answer. Who always, at least they put on their thinking caps. They start thinking, which is the most important thing. Because even when you become doctors, you can never be sure of a diagnosis. Okay, now if something is bothering you, if there is some something in the diagnosis that you cannot make out. Suppose some patient comes to you, okay, and now if you're young doctors, you have just started your practice, then what happens is you have to diagnose what is wrong with the person, okay. If you're not in the habit of thinking, if you're not in the habit of thinking and judging what is happening, and taking down the importance of symptoms, whatever symptoms the patient is presenting with, the history, the signs, whatever you are examining, if you're not in the habit of putting all of these together and having a thought process, then it becomes very difficult to be a good clinician, okay. You cannot, and until and unless you diagnose diseases, you cannot be a good doctor. So for diagnosing diseases, you should start from the first year itself, and you should never never hold yourself back from making any sort of guesses. Guesses means informed guesses, okay. Like here, that is why I always appreciate people who answer, even if they don't know the concept, but they know something about it, but they at least attempt the answer, and that is very good, okay. That is the sign of someone who is going to become a very good clinician, okay. So congratulations. Now the question here is, what are the main keywords? The keywords here are Reena is asking, ma'am, first year will start from April this year. Oh wow, Prerna isn't even in college right now. She has answered on the basis of her NEET preparation. Okay, very good, Prerna. All right. So, just a second. There seems something wrong with. Just give me a second. All right, guys. Just see here. I'll just fix it. Okay. So I don't think it is possible to write on this right now. There seems to be some issue, some technical issue. I'll just speak it out and you understand, okay? In the next session, I'll try and make sure that this thing is resolved and then I'll come. But right now, I'll just speak it out and you try and understand, okay? The patient is presenting with macrocytic anemia, homocysteine urea and normal methyl malonate levels. What is the most appropriate treatment for him? See, macrocytic anemia is because of, macrocytic anemia means the RBCs are not getting matured. Now, because they are not getting matured, what is happening is, the size of the RBCs is large. Okay, because as the RBCs mature, what happens? Their size gets reduced, isn't it? As the RBCs mature, their size gets reduced. So right now, the RBCs are immature, therefore their size is large, therefore it is macrocytic anemia. All right. Now, for the RBCs to develop, it requires what? It requires vitamin B12 and folic acid. Folic acid is what? Vitamin B9. Okay. So, this now what happens is, this for if you see macrocytic anemia, what will you think? The treatment is vitamin B12 and vitamin B9, both folic acid and vitamin B12. Okay, but look at the rest of the question. The rest of the question says homocysteine urea and normal methyl malonate levels. Okay, so homocysteine urea is, why is homocysteine urea coming in? Now methionine gets converted into homocysteine with SAM, that is S-adenosyl methionine and S-adenosyl homocysteine as the intermediates. Okay, so S-adenosyl methionine So methionine will convert to S-adenosyl methionine, that will convert to S-adenosyl homocysteine, and that is going to convert into homocysteine. Okay. Now this homocysteine can be converted back to methionine utilizing tetrahydrofolate. What is folate? Folate is folic acid. Okay. Now tetrahydrofolate is used in 1-carbon transfer reactions. What are these 1-carbon transfer reactions? 1 carbon means methyl, isn't it? C1. 1 carbon is methyl group. So 1-carbon transfer reactions utilize uh, tetrahydrofolate. Okay. So now this tetrahydrofolate is going to give its methyl group. This methyl tetrahydrofolate is going to give its methyl group to homocysteine, and then homocysteine is going to convert to methionine. Okay. Now the methyl tetrahydrofolate has become tetrahydrofolate only. Okay. Now what will happen? This tetrahydrofolate has to go back and become methyl tetrahydrofolate again. So what will help it? Methyl cobalamin will now come. This methyl cobalamin will give its methyl group to tetrahydrofolate. Tetrahydrofolate will become methyl tetrahydrofolate. Okay. And now this methyl cobalamin is going to become cobalamin. So this is how this 1-carbon group, that is methyl group, is transferred from methyl cobalamin to tetrahydrofolate to methionine. Understood? This is 1-carbon reaction. Now there is homocysteine urea. If there is homocysteine urea, that means homocysteine is high. If homocysteine is high, that means it is not getting converted to methionine, isn't it? If homocysteine is high, it is not getting converted into methionine. Then what does it mean? It means there is deficiency of these 1-carbon donors. That means there is deficiency of either tetrahydrofolate or cobalamin or both. So again we are coming to macrocytic anemia can be due to B9, B12 or both. Homocysteine urea can be due to deficiency of B9, B12 or both. तो अभी तक हमारे आंसर कैन बी ए, बी और सी, तीनों में से कुछ भी कैन बी द आंसर. नेक्स्ट आता है मिथाइल मैलोनेट लेवल्स. मिथाइल मैलोनेट का क्या काम है? Propionyl CoA. What is propionyl CoA? Propionyl CoA, prop in organic chemistry, is 3 carbon. Propionyl CoA is derived from beta oxidation of fatty acids. Which kind of fatty acids? Odd carbon containing fatty acids. So beta oxidation of odd number of carbon containing fatty acids, that is, if 25 carbon containing fatty acid is oxidized, what will happen? 3 of its carbons will go to form propionyl CoA. Then 22 carbons will remain from 25, and these 22 carbons are going to form 11 acetyl CoA molecules. We have discussed this. So the propionyl CoA molecule that is formed, this will convert into malonyl CoA. Malonyl CoA. Okay. Malonyl CoA is then going to convert to succinyl CoA. And where have you heard of succinyl CoA? Come on guys, where have you heard of succinyl CoA? It is seen in the Krebs cycle, isn't it? Succinyl CoA is present in the Krebs cycle. So this succinyl CoA will then enter the Krebs cycle, and it will enter glycolysis. It will enter the glucose metabolism. Okay. Now, malonyl CoA utilizes vitamin B12 to convert into succinyl CoA. Okay. Now, if methyl malonate levels are normal, then what does it mean? That B12 levels are also normal. Had B12 levels been deficient, then methyl malonate levels would have been high, because methyl malonate could not be converted into succinyl CoA. Understood? So now we can infer that B12 is normal. So what is deficient, which is causing macrocytic anemia and homocysteine urea? B9, that is folic acid. So the correct answer is, guys, the correct answer is B, vitamin B9 or folic acid. Okay, the correct answer is, you will supplement the person with vitamin B9 or folic acid. Got it? Extremely important. There's something wrong with the pen tab. I'll make sure that it gets working in the second session. Okay. Otherwise, yeah, that is why I'm not able to write anything here. Okay. Understood? Anyway, so now consider this question. I'm going to give you 5 minutes. Try and answer. The reducing agent used in lipogenesis, that means genesis of lipids, lipogenesis, is derived from A. Gluconeogenesis, B. Glycolysis, C. Beta oxidation, or D. HMP shunt. Okay, try and answer this. Come on, try and answer. The reducing agent used in lipogenesis is derived from. Come on, guys, come on. Come on, all of you, try and answer this. Come on, 3 more minutes. Try and answer. Understand what it is asking. This is a particular cycle which we have discussed, excuse me, a lot of times. Come on, try and answer, guys. Last 2 minutes for answering. Last 2 minutes, and then I'll start with the explanation, okay? This is a particular cycle that I'm talking, that this question is asking about. Okay, so last 1 minute. Okay, so I'll now tell you the answer. All right. The answer to this is the reducing agent used for lipogenesis. Lipogenesis means synthesis of fatty acid. Very good. Prerna has come up with the answer. It is HMP shunt. Very good, Prerna. And what is this reducing agent that we are talking about? What is this reducing agent? Lipogenesis is synthesis of fatty acid. It is also used in synthesis of cholesterol, synthesis of steroids, in glutathione metabolism. What is this reducing agent, Prerna, that we are talking about? This reducing agent that we are talking about is NADPH2, isn't it? This NADPH2 is going to give its H to other molecules, and giving H, that means it is getting oxidized, and the other molecule that is accepting H, that molecule is getting reduced. Okay, therefore it is a reducing agent. Okay. Now, how is the HMP shunt working? HMP shunt is the pentose phosphate shunt or the hexose monophosphate shunt. Now, what happens here is that 3 molecules of glucose 6 phosphate will enter this shunt. Glucose is an hexose. 6 phosphate, that means 1 phosphate group is there. So this is a hexose containing 1 phosphate group. Therefore, it is a hexose monophosphate. Okay, and what is pentose phosphate? This will now in turn convert to a pentose, that is ribulose 5-phosphate. Okay, so ribulose 5-phosphate is also a pentose, therefore it is also called pentose phosphate pathway. Okay, now 3 molecules of glucose 6-phosphate are going to be acted upon by the most important enzyme in hexose monophosphate pathway. What is that enzyme? Tell me. That enzyme is G6PD, that is glucose 6-phosphate dehydrogenase. Dehydrogenase means it is removing hydrogen and giving that hydrogen to NADP. This NADP is going to become NADPH now. Okay. Next is going to form 6-phosphogluconate. This 6-phosphogluconate will then form ribulose 5-phosphate. Now these 3 ribulose 5-phosphate molecules, 2 of them will produce xylulose 5-phosphate. Okay, and xylulose and ribulose are epimers at the 3rd carbon. Okay, so you have ribulose 5-phosphate, 2 ribulose 5-phosphate are going to form 2 xylulose 5-phosphate, which are epimers, and 1 ribulose 5-phosphate is going to isomerize to form ribose 5-phosphate. Okay, now xylulose 5-phosphate is going to donate 2 of its carbons to ribose 5-phosphate, and ribose will become pseudoheptulose 7-phosphate, and that xylulose 5-phosphate is now going to become glyceraldehyde 3-phosphate. That is a 3-carbon compound. Then this glyceraldehyde is going to take 2 carbons from pseudoheptulose, and it will now become it is going to take 3 carbons from pseudoheptulose, and it will become a 6-carbon fructose 6-phosphate. And the pseudoheptulose has given it 3 carbons here, so it has become a 4-carbon compound called erythrose 4-phosphate. Okay, Now this erythrose 4-phosphate is going to take 2 carbons from the second xylulose 5-phosphate, and the xylulose 5-phosphate is going to become the 3-carbon glyceraldehyde 3-phosphate. So we have 2 fructose 6-phosphate, 1 glyceraldehyde 3-phosphate. Now 1 glyceraldehyde 3-phosphate can undergo glycolysis to form what? This glyceraldehyde 3-phosphate can undergo through glycolysis. That is, glycolysis is a reversible step. Okay, so all the reversible steps of glycolysis will happen. Fructose 1,6 biphosphate, fructose 6-phosphate, and then glucose 6-phosphate. So you saw how it is starting with glucose 6-phosphate and it is ending with glucose 6-phosphate. So what is the utility of HMP shunt? The utility is that it is producing NADP, which are reducing agents used in lipogenesis, in glutathione metabolism, and in steroid synthesis. Also, it is forming ribose. What is ribose? Ribose is used as sugar in synthesis of nucleic acids. Okay, ribose in RNA, deoxyribose in DNA. Where is ribose coming from? Ribulose 5-phosphate is forming ribose 5-phosphate. Understood this? Okay, I have discussed this a lot of times on this channel also, and on Unacademy special classes also. You can go back and attend that. Now I'll try and fix my stylus, which has stopped working now, and I'll see you in the next class. Okay, the next class might be delayed because I'll try and fix my stylus. Okay, all right, guys. Then you can subscribe to this channel and you'll get the notification when I'm live next. Okay, understood? Next will be another 2 questions we'll be discussing. So right now we discussed the HMP shunt, and we also discussed what? We also discussed this 1-carbon transfer reactions. Okay, homocysteine and methionine metabolism. In the next class, we'll meet with another important question. Okay, till then, subscribe to this channel and share it amongst your friends so that we have even more learners interacting together. Okay, bye bye, guys. See you.